A very good evening to all of you. Today we are going to do the pharmacology subject MCQ challenge. This pharmacology is a very important subject as far as Neet PG is concerned, and pharmacology has a weightage of about 20 to 22 questions in the Neet PG and about 15 questions in INSCT. And with the sound knowledge of pharmacology, you can solve a large number of questions in medicine and pediatrics also. So let's begin with the first question. Clinical effect of vitamin D. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytate. B. Simultaneous ingestion of lactose. C. Acidic environment. And D. None. What do you think is the correct answer here? It is simultaneous ingestion of phytates. So the main clinical effect of vitamin D is to enhance the intestinal absorption of calcium. With an average intake of 1000 milligram of calcium in its net intestinal absorption is only 150 to 200 milligram per day. Calcium is absorbed mainly in the duodenum and jejunum, proximal intestine, by an active transport mechanism which is regulated by 125 dihydroxy. Parathermone indirectly promotes absorption of calcium by increasing the renal synthesis of 125 dihydroxy D3. Dietary lactose, proteins, and an acidic environment promote calcium absorption. So the correct answer here is simultaneous ingestion of phytates. Which of the following is a drawback of extended release preparation? A. Frequent high peak side effects. B. Decreased compliance. C. Increased cost. D. No dose dumping. It is increased cost. Extended releasing drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the body, thus avoiding peaks of high and trough of low plasma concentration. So the correct answer here is increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? A. Tenofovir. B. Zidovudine. C. Atazanavir. D. Nevirapine. See, the drugs with established toxicity in case of Crigler-Najjar syndrome are irinotecan and atazanavir. These drugs are metabolized by glucuronidation. So the correct answer here is C. Atazanavir. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity, D. Small intestine. An acidic drug is maximally unionized in the stomach, but as it has a thick mucosa and a small surface area, maximum absorption takes place in the small intestine. Which of the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A, D. Estrogen receptor. See, ligand gated ion channels are the fastest acting receptors. Ligand gated ion channels are the fastest acting receptors. The only ion gated channel is GABA A. So the correct answer here is C. GABA A. Anandamide is A. Opioid. B. CK1 antagonist. CK1 antagonist. C. D2 blocker. D. Cannabinoid neurotransmitter. This anandamide is also known as N-arachidonyl ethanolamine or AEA, is an endogenous cannabinoid neurotransmitter. The name is taken from Sanskrit word ananda, which means bliss, delight, and amide. It is synthesized from N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase FAAH enzyme, which converts anandamide into ethanolamide and arachidonic acid. As such, inhibitors of FAAH leads to elevated anandamide level and are being pursued for therapeutic use. So the correct answer here is cannabinoid neurotransmitter. The drug in the delivery system given below is A. Topical use, B. Systemic use, C. Both topical and systemic use, D. None. Well, this is a transdermal patch and it is used for systemic use of drugs. So the correct answer here is B. Systemic use of drugs. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? A. Bosantan, B. Sildenafil, C. Epoprostenol, D. Nifedipine. See, you can see the prominent pulmonary arteries in the X-ray, which is consistent with the diagnosis of pulmonary artery hypertension. And this is a stage 4 PAH. So the drug of choice is IV epoprostenol. So the correct answer here is C, epoprostenol. Acidic drug binds to A. Globulin, B. Alpha 1 glycoprotein, C. Albumin, D. None. See, many natural substances circulate around the body parts free in plasma water and partially bound to plasma protein, example cortisol, thyroxine. Similarly, drugs circulate in protein bound and free state, and the significance is that free fraction is pharmacologically active, whereas the protein bound component is reservoir after that is inactive because of this binding. So the correct answer here is C. Albumin. The drug in picture is used for A. Breast cancer, B. Routine contraception, C. Emergency contraception, D. Abortion. It is emergency contraception. Sugamadex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. It is reversal of neuromuscular blocker. Sugamadex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant rocuronium and vicuronium. It is a modified by cyclodextrin with high affinity for rocuronium and vicuronium. It encapsulates one molecule of neuromuscular blocker within its molecule, forming an inactive chelate which is excreted in urine. So the correct answer here is reversal of neuromuscular blockers. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. It is kidney. Cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 4% excreted in bile. So correct answer is C. Please click the link in the description box to join the 2-day Ultimate Neet PG Breakthrough Blueprint event. Here, there will be a rapid coverage of all the 19 subjects in the most holistic possible manner. And the first 10 people who click the link in the description box will get this masterclass absolutely free. What is the type of receptor given in the picture? A. GPCR, B. Ion channel receptor, C. Enzyme linked receptor, D. Nuclear receptor. Well, the pentameric structure you can see in the picture. It is made up of 2 alpha, 1 beta, and 1 delta subunit. Nicotinic receptor is NHA ion channel receptor. So the correct answer is ion channel receptor. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. On. It is all. Duration of action depends on clearance, rate of elimination, bioavailability, and all. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Ibutylate, D. Aceclidine. It is amiodarone. Now, drugs causing hypothyroidism are lithium, sulfonamide, phenobarbital, phenytoin, amiodarone, para-aminosalicylic acid, rifampicin, carbamazepine. So, correct answer is A. Which of the following anti-migraine drug might have caused a side effect? In the picture, you can see gangrene is there, end artery finger is involved, and this is caused by ergotamine. Ergotamine causes severe peripheral vasoconstriction and hence gangrene. So the correct answer is D. Dopamine, all of the following is true except A causes increase in GI ischemia, B positive inotropic, C improves renal perfusion, D vasoconstriction. It is causes increase in GI ischemia. Please click the link in the description box to join the 2-day Ultimate Neat PG Breakthrough Blueprint event, and it will be highly beneficial for you because all the 90 subjects will be covered in a holistic manner. And please share this link also to your friends, as many friends as possible. I want everybody in the country to attend this masterclass so that they get a very good score. So at least you share it with your near and dear ones. You can share the link directly to your near and dear ones. You can also share the link of these videos to your friends. It will be very beneficial for them. And also, you also sharing is caring. Next question. The side effect of digitalis are all except A. Ventricular tachycardia, B. Vasodilatation, C. Nausea and vomiting, D. Ventricular bigeminy. It is vasodilatation. Digitalis causes mild vasoconstriction and not vasodilatation. So the correct answer here is B. Vasodilatation. Anti-androgen used in heart failure is A. Carvedilol, B. Sampatrilate, C. Spironolactone, D. Abiraterone. It is spironolactone. Spironolactone and epinephrine are aldosterone antagonists. They are used as potassium-sparing diuretics. Their diuretic effect is quite feeble, but in CHF, these drugs reduce the mortality. So the spironolactone possesses anti-androgenic effect. It is spironolactone. Which of the following drug might have caused a side effect given in picture? A. Antacid, B. Bismuth, C. Cisapride, D. Sucralfate. It is bismuth. Bismuth can cause black discoloration of stool and tongue. Gemcitabine is used mainly in which cancer? A. Colorectal, B. Breast, C. Pancreatic. It is pancreatic cancer. Maximum liver toxicity is seen with which antibiotic? A. Isoniazid, B. Rifampin, C. Pyrazinamide, D. Streptomycin. It is pyrazinamide. Fastest acting antithyroid drug is A. Iodide of NAK, B. Propylthiouracil, C. Methimazole, D. Nitrate. It is iodide of NAK. Iodide of iodine is the fastest acting thyroid inhibitor. Most important action is inhibition of hormone release, that is thyroid constipation. But all facets of thyroid synthesis may be affected. Excess iodide inhibits its own transport in the thyroid cell and may alter the redox potential of the cells, thus interfering iodination. So reduced thyroid T4 synthesis, which is known as Wolff-Chaikoff effect. Natalizumab is used in the treatment of A. Multiple sclerosis, B. Breast cancer, C. Psoriasis, B. Cell lymphoma. It is used in the treatment of multiple sclerosis. Special feature of Glargine insulin is that A. It produces a smooth peakless effect. It is not suitable for once daily administration. It remains soluble at pH 7. Uh, it can control meal time. Mechanism of action of trilostane is it is 3 beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction: A. Prazosin, B. Pentagocin, C. Phentolamine, D. Phenoxypyrimide. It is phentolamine. Essential drugs included in National Pharmacopoeia should always be present at PHC. Those who that satisfy the primary healthcare needs of population. C. Life. D. These are those that satisfy the primary healthcare needs. Post-marketing surveillance is included in which phase of clinical trial? A1, B2, C3, D4. Post-marketing surveillance is after the drug is out in the market. It's a part of phase 4 of clinical trial. It includes the follow-up patient taking the drug, adverse drug reaction, risk. Which of the following is most active against the slowly dividing tubercle bacilli? A. Isoniazid, B. Rifampicin, C. Streptomycin, D. Ethambutol. It is rifampicin. Drug contraindicated G6P deficiency is A. Chloroquine, B. Primaquine, C. Quinine, D. ALL. It is which of the following anti-cancer drugs are competitive inhibitor of tyrosine kinase? A. Imatinib and sunitinib, B. Letrozole, B. Bicalutamide, fulvestrant. It is imatinib and sunitinib. Which of the following drug might have caused the effect given in the picture? A. Somatropin, B. Octreotide, C. Insulin, D. Gosselin. It is insulin. Lipohypertrophy you can see at the site of injection due to inhibition of lipolysis can be seen with insulin. Ranibizumab is Monoclonal antibody against IL-6, BCD20, BEGF, EGF, hepatitis C, VEG.